This is Well, Australian women. Welcome to your full body health check. I'm Claire Murphy, the journalist who wants to know everything about your health, and let's be honest, my own while we're at it.
And I'm Dr. Mariam, the GP girlfriend that you wish you had so you could ask all those annoying health questions over a glass of wine midweek.
Look, today we're trying to focus so we can talk about ADHD. I'm so sorry if that is a terrible, terrible joke.
I forgot what you said.
Stop it. We are legitimately going to find out if those ADHD tests on TikTok are real or bullshit. We're going to look at the pros and cons of medicating and how we manage some of the tougher parts of an ADHD diagnosis, like, you know, your partner feeling like you just don't care when really you're struggling to remember things. We'll also be heading into a quick consult where you can ask our very own Dr. Mariam anything about your weird and wonderful body doing weird and wonderful things. Today, Amali says she's got no idea how to tell the difference between a good lump and a bad lump. But first up, it's time to head to med school for today's lesson on why your vagina's problem might also be your partner's fault.
Welcome to med school.
Look, we found something out recently which is very interesting because we as women have been dealing with it pretty much solo. But we've heard it actually can get better if we treat the men in our lives too. So an Australian clinical trial found that bacterial vaginosis can actually be transmitted sexually and that treating a sufferer's male partner for it could reduce reinfection and reoccurrence. So technically, it is also an STI. According to Professor Katrina Bradshaw, who co-authored the study, it appears the penis and its microbiome. I don't know why I get weirdly laughy when I say the word penis. I'm very immature. I'm so sorry. Penis. And its microbiome plays a role in some instances, not all of BV, bacterial vaginosis cases in their partners, with uncircumcised men having a more, how should we put this, diverse microbiome than circumcised men, including the types of bacteria that can take over the vagina.
Yes, this is such a great study, and I'm hoping this is going to lead to guideline changes and maybe a new name, bacterial piniosis. That sounds like Harry Potter doing some kind of spell. Bacterial piniosis. But yeah, recurrent BV, massive issue. Something I see all the time in clinic. We know BV affects 1 in 3 females of reproductive age. We treat it 50% of the time. It will come back within 3 months. It's very frustrating, very difficult to treat. So yeah, now with this study, we're seeing there's potentially maybe some going back and forth from partners getting treated, then she's having sexual contact again with her partner, they're getting reinfected.
Well, you know, like, men, you're not responsible for all the things, but in this instance,
most of the things.
You are,
let's be honest,
responsible, maybe, in this instance.
Bacterial piniosis.
Be gone. Okay, grab your fidget spinners, folks. It's checkup time. Today, we are talking about ADHD.
Yes, let's do it.
It's time for the checkup.
ADHD is really having a moment on social media right now. I particularly love this song by Guy with the Hair on TikTok. So funny.
I have ADHD and just maybe it's a thing that sometimes I get distracted with, oh look, a shiny ring. I start a project, then my god, like 9 hours go by, and all I've done is started 20 other things and cry. When I'm super hyper focused, yeah, I notice everything, but when I'm not, my frazzled thoughts go bibbity bobbity bing. I don't think it's a secret that some people think I'm different just cause I have the attention span of a goldfish or a pigeon. So if you are like me and talk at 90 miles per hour, then help me normalize us born with ADHD powers.
And I also saw this really great video of lots of hidden symptoms of ADHD. So people who actually have been diagnosed with it talk about the ways in which they knew maybe they were. Things like being able to predict the movie plot from the get-go. So your worst cinema-going friend you could potentially have. Hating appointments if they're in the afternoon because it is way too long to be in waiting mode. And being able to smash out an essay at the last minute, even though you've had like actual weeks to get it done. But then also constantly losing your things, not being able to remember someone's name and fighting with your significant other because you forgot that thing again. And it's actually believed to be the most common mental health condition around the globe. There's about 1 million Aussies who have been diagnosed. Mariam, if someone does come into your rooms and you have a suspicion that they might have ADHD, what are you actually looking out for? And are you seeing more people come forward looking for a diagnosis now?
Yeah, so if someone comes into my clinic and I suspect or they suspect they might have ADHD, I'm looking out for a few key signs and symptoms. And I usually kind of direct the consult by using like an ADHD adult questionnaire, which kind of helps weave through and kind of direct those questions so I can get those answers that I need. So we know that there's 3 types of ADHD. So there's the hyperactive and impulsive type. And generally the signs we see with that are you're restless, you're agitated, you're fidgety, you're interrupting conversations, you can't wait in a line, you're talking over people, you're acting impulsively and you're not thinking of consequences.
And this is what we see commonly in like young boys in schools where they're like wreaking havoc.
Yeah. And so I think that's kind of the picture people always assume ADHD looks like, but it doesn't always look like that. It can also be the inattentive type. And this is where most females generally tend to fit as well. And with here, we're looking for difficulties with attention. So difficulties starting tasks, initiating tasks, finishing tasks, poor time management, forgetting appointments, easily distractible. You're going off with the fairies, you're daydreaming, you're losing things, you're procrastinating. And the third type is a combination of the two as well. So I also consider the context of these symptoms, whether they were present in childhood and their effect on your quality of life in different settings, whether that's work, at home and in relationships. And then family history is also a big part of the consult as well. As for whether I'm seeing more people come in, definitely. And I think that's just because ADHD is finally getting the platform it deserves. There's a lot more awareness. People, I think the stigma around mental health is slowly kind of shifting and people a lot more open having these conversations, and people feel like, oh, this is something I potentially might have. I'm going to seek a diagnosis and clarification and try to get the support that I need. So in clinic, one of the 4 things generally happen. I get someone come in and they're like, hey, my partner thinks I have ADHD.
Okay. Yeah.
Or someone's seen something on socials and it's like, hey, I tick off on all these things. Do you think I have ADHD? Interestingly, being a female GP, I see a lot of patients going through the perimenopausal space. And I'm picking up ADHD so much in these patients. A lot, from my own conversations with the patients, but a lot of the time they're like, hey, I think I have ADHD. We know those hormonal changes can exacerbate a lot of the symptoms of ADHD. Yeah.
What co-occurring conditions can come along with ADHD? Because I understand that it sometimes can also live alongside quite a few other mental health issues.
Yes, that's right. So a high proportion of people with ADHD also have co-occurring neurodevelopmental disabilities. They might have mental health or medical conditions. With adults specifically, we see anxiety, depression, bipolar disorder, personality disorders like borderline personality, a narcissistic personality disorder, antisocial personality disorder, and also substance use disorders. And so medical conditions can also co-occur with ADHD. And we see that with epilepsy, acquired brain injury, and fetal alcohol spectrum disorder.
Okay.
Yeah.
What do people need to do to prepare for a diagnosis? Because I've had a lot of people speak to me about this because I do have quite a few people in my orbit now who have been diagnosed who are women and later on in life, but they talk about the fact that it does require making a lot of appointments. It requires doing a fair bit of paperwork like the questionnaires that you were talking about, and that it can actually be quite costly to get a diagnosis.
Unfortunately, that is the case. GPs are really pushing for a massive reform with ADHD, and we're hoping that will come in the near future. But for the time being, it is a bit of a process. You start by seeing your GP. Your GP will assess your symptoms and your history. They'll use those screening tools and questionnaires in the consultation or send you home with them. And if they do suspect you have ADHD, you'll be given a referral to a psychiatrist or a psychologist who has that specialty in diagnosing ADHD. It's your preference where you want to go, but a lot of people prefer just going straight to the psychiatrist because they can prescribe the medication if you do have ADHD and the medication is needed. So you just kind of save that extra step. And unfortunately, diagnosis does come with a hefty price tag, and that could range from $1,000 to $3,000, with limited rebates. But to make your appointments more effectively, I will offer some advice which people might find helpful. And so I always say document your symptoms. So anything you suspect might be ADHD related, just put it all down in a journal and write its impact on your quality of life and how long you've had these symptoms, what school life was like for you, what your partner thinks, what your family thinks, those sorts of things. gather your history. So if you've seen, mental health professionals in the past, try to get your notes from them as well. That will be really helpful for the psychiatrist or psychologist to collaborate and help with the diagnosis. So complete the questionnaires and take those to the appointment and prepare questions. So if you are diagnosed with ADHD, you're going to leave with a million questions. Try to think, okay, if I do have ADHD, what are things that I want to know? Write them down and make sure that you get those answers before you leave that appointment. And ask for support. So bring a friend or a trusted family member for emotional support or to help remember important details, and get that organisational help. So a big part of why people find the diagnosis process difficult is because of that organisational part. So if you do struggle with organisation, asking a friend or family member to assist with checklists or workbooks to help you feel a little bit more prepared.
I need to ask you about another person who can potentially be in your ADHD diagnosis journey, and that is the ADHD coach. In this instance, who is an ADHD coach, and do you ever refer people to them?
Yeah, definitely. So the Australasian ADHD guidelines actually recommend ADHD coaching as a valuable non-pharmacological tool for managing ADHD. And the approach focuses on educating people about ADHD, leveraging their strengths, and developing practical strategies to modify behavior. So like, emotional regulation, time management skills, those sorts of things. The coaches might be allied health professionals, or they might be specialized ADHD coaches. It's just important to ensure that they're affiliated and credited by the International Coaching Federation. So if you have booked in, make sure that they have that tick of approval. That's really important. The only issue with accessing ADHD coaches is that it might require a private payment, so there might not be any Medicare rebates. Some psychologists do offer that service, and if they do, then you might get some rebate through the Better Access plan.
Okay. I've got visions of what an ADHD coach looks like.
Yeah.
They've got a whistle, obviously, and then like a bucket full of fidget toys. Coming up in today's quick consult, Amali's boobs are not helping her when it comes to checking to make sure they're not growing a nasty lump. But next, we're going to be speaking to Dr Kieran Kennedy. He's a psychiatrist who specialises in ADHD diagnosis and treatment in adult women. He says it's more than just not being able to concentrate, but getting diagnosed could help save your marriage and your job too. Kieran, thank you so much for joining us today to dispel some ADHD myths and beliefs. But we wanted to start with something that has become more apparent in recent years, and that is that ADHD presents differently in girls and women as opposed to what it does in boys and men. I'd like to get you to give some understanding as to why that is, but also then why that means women's diagnosis is often quite delayed.
As you say, there's so much out there at the moment around ADHD. And I think in a lot of ways, girls and women are being hit with the brunt of a lot of that information. And I obviously see a lot of women sort of questioning ADHD as a diagnosis at whatever age and stage they might be at. And I think it is this really growing awareness, thankfully, now, thank God, around ADHD presenting differently, not just for girls and boys when we're younger, but also for men and women as well. We know that that's different for a number of reasons. I mean, as with all medicine and mental health, there's an element of biology potentially there in terms of how ADHD presents differently in the brain for girls and boys versus men and women as well. But a really interesting part to it is that women often present more with inattentive features of ADHD, which is where the struggles are actually less overt or externally kind of observable. And so that might be focus and distraction related issues. It might be really struggling with rejection sensitivity, organization, procrastination, all of these elements that I think for a long time we didn't traditionally see on the surface as being ADHD, compared to, say, the more hyperactive or behavioral features, which are a lot more common in boys and men comparatively. But I guess I want to dovetail in there as well and say that I think for women and for a lot of adults, in terms of adult ADHD for women, we're also seeing that culture, gender pressures, socialization, this has a huge part to play for ADHD for women and girls as well, because even if there are hyperactive elements or other features, I think from an early age, girls are pressured to be behaving in a certain way, presenting in a certain way. And so I speak to a lot of women who have their entire lives really known and felt something's there on the inside, but they've sort of been pressured in a way to containing that, and to actually never really allowing themselves in a lot of ways to kind of align with or really recognize those features of ADHD that might be there all along.
Well, some of the things that we're seeing these women experience include things like time blindness, which is, I've only just come to realize, is something that our boss, Mia Friedman, has to deal with, because she believes in her brain that everything is just 20 minutes, either 20 minutes to do, 20 minutes away. And so she doesn't have a comprehension of just how long things might take to do or to travel to. And so that then will often lead to things like chronic lateness.
Yeah.
How do we find strategies to deal with those kinds of things?
Yeah, really tricky. And I mean, time blindness is a really, really interesting one that so many women and just people of all genders struggle with when it comes to ADHD, but it's not one we typically sort of really put at the front of our mind. But it is one, as you say there, Claire, that can really impact our work. It can impact our relationships, our personal goals. And so I think when it comes to time blindness, as I sound like a bit of a recording tape when I say I think for psychiatry, it's that level of insight that's the first step, and that's key. I think often with time blindness, we're often just that. We're blind to the fact that we can actually really struggle to sort of conceptualize time in our mind and how long things might take, or that we need some scaffold. So I think being aware that time blindness might be part of ADHD for you is a really, really kind of key one to just acknowledge it. And then, strategies for that do come around just giving ourselves more structure and planning when it comes to timing. It's also practice. We know that for ADHD, a lot of these things do gradually kind of change and can improve with time and practice. So it's almost like a little bit of a muscle. I talk to some of my ADHD patients around when it comes to things like time blindness. Each time we cotton on to the fact that, hey, I might actually need slightly more time for that task or activity, and then we put that into place, we're actually teaching our brain and our neural connections to become a little bit better at kind of judging time and planning and scaffolding for that. So it's a little bit of a work in progress.
Does ADHD affect your memory? I know a lot of people that I've spoken to have said that quite a few of them said the same thing, that they'll often be introduced to people and forget their names immediately. And I know that doesn't always mean that you have ADHD, but for those who do have it, they're concerned that their memories are actually impacted by ADHD. Is that a thing?
Absolutely. Struggling with memory and what we call retention, which is kind of getting information to actually stick in that moment, a bit of a simple way of describing it. Memory and retention are really prominent features of ADHD for a lot of people. And it's, amazing how many people I see who actually get a little bit emotional or obviously anxious when we come to this point of the assessment, because they've often said to themselves, my God, I wonder whether I'm sort of getting early onset dementia here, or I just always felt like something was actually wrong with my brain when it comes to memory. But if we really sort of nail it down, it's not so much an issue with the actual memory or recalling things or laying down memories. It's more an issue with that attentional dynamic, meaning our brain didn't quite get the chance to sort of take in, focus on, and retain that information from the get-go. And so that's where things like names, being given instructions by a colleague or our partner, conversations, even remembering that appointment is on at 2 p.m. like I, thankfully remembered today, where, it's often the sense that it's not the hardware of our brain that's struggling to actually lay down memories and recall them. It's the fact that attentional dynamic of ADHD impacts being able to take in that information and then recall it later.
Why do stimulants work differently on an ADHD brain? Like, for those who don't, a stimulant stimulates, obviously, whereas people who have ADHD often, they'll say that it calms them down. Why is that?
Yeah, super interesting one, and it's obviously the case that all of us will react slightly differently if we were prescribed a medication or if we trialed a medication. But for those with ADHD, the obvious neurological underpinnings and the chemical underpinnings there mean that the brain reacts and responds differently to a stimulant medication than someone might who doesn't have those same neurological and neurochemical kind of pathways that are
So
different
the
for
chemical
brain.
soup in the brain, like when you add
Absolutely.
different ingredients, comes out differently, essentially.
100%. Yeah, I
Okay.
love that as well. Like if we think about a little bit of a mixing pot in terms of our neurochemical balance, we know that there are parts of the brain for an ADHD or neurodivergent brain where levels of things like dopamine, for example, that's a big one when it comes to ADHD. The balance of these is at a slightly different level in terms of circuits and connections for someone with ADHD compared to someone who has a more neurotypical brain.
A lot of people who have ADHD say they struggle with personal relationships, and
Mm,
it can be for various reasons. I mean, the time blindness and the chronic lateness and, the memory issues, like all of that can add up if you are in a relationship with someone who has ADHD, and they can get
yeah.
frustrating. But are there strategies to help improve communication for someone who is struggling to maintain a relationship?
Yeah, definitely. And I think, for so long as well, we focused on for kids, obviously, with school and learning, but also for adults when it comes to study, but also work. We focused on that very work, learning, study related side to ADHD and how these symptoms impact kids and adults. And especially for adults, we know that the impacts on relationships and our personal lives are just as wide reaching and significant. And relationships is an area where those with ADHD can really struggle. And as you say, it's often to do with a number of different things, but I think it's often the level of again calling that out and insight around what's happening and why that I see making the biggest difference. And I think part of my work and working with people with ADHD that I love so much is just these beautiful little ripple effects to a diagnosis that we see. And I have so many patients say, God, things have been so much better with my partner and with my nearest and dearest since the diagnosis, because not only now do I understand where some of these things were coming from, but they have a much gentler, more open understanding of that as well.
It's
And
amazing
so
how
if
your
you
patience levels can change when you understand that someone is struggling, not just because they're being an asshole, but genuinely because they are struggling.
Exactly.
Yeah.
Yeah, and that's the thing. I think before the diagnosis, not only can the person with ADHD themselves take on that internal reflection of, I just can't do this, I'm forgetful, I'm, you know, quote unquote, a bit of an asshole in certain situations. But I think, unfortunately, for no fault of their own, our partners, our closest friends, our family can also interpret some of these things as maybe a more active sort of behavior. And with ADHD, we know obviously that things like forgetting a conversation with our partner or struggling with time management or getting to the restaurant to meet them on time, these things are not anything to do with an active sense of trying to do those things or not finding that relationship important or not valuing that information or that time. It's just that these things on a more neurochemical level are very, very difficult. So I find that actually just leaning into understanding the diagnosis and exploring that with your partner and nearest and dearest can have a huge difference just because that level of insight's there. But also, I think, I've found that couples who talk around the symptoms and how best to go about supporting them also tend to do, a lot better. And so, as hard as it is, I think if we have an ADHD diagnosis and we feel elements impact our relationships or our intimate relationship, it is about leaning into getting a bit uncomfortable around. We've both recognized that there are times where you ask me something or tell me something, and I might forget to do that or partly do it and then get distracted and go off course. How can we work together to kind of navigate this? And that might be as simple as a partner saying, I'll try and remember to check in on you and ask you a second time in 5 or 10 minutes if you've done that thing. And again, it's not around putting pressure on people or symptoms, but it's just about, I think, opening to this gentler understanding as a couple as to where these things are coming from. And it's the conversations about things being symptoms, not active behaviors, where that can really start to grow.
Can we talk about diagnosis? Because if you're to
Mm,
believe social media, you can ask one question. Like I was just watching a video of someone who said, pretending to be the therapist saying, do you interrupt people a lot? And the
mm,
person who's the patient says, no, I don't. She says, no, because I'm constantly stopping myself in my head saying, don't interrupt, don't interrupt, don't interrupt, don't interrupt, and thinking about what it is that I'm going to say to contribute to this conversation, and then forgetting what I was going to say. And then the
Yes.
therapist person just goes, oh, you definitely have ADHD. Like, is it,
Yes.
is it that simple?
Unfortunately not. I mean, my job would be a lot easier if it was. But no, I'm so like glad that you wanted to like chat on this point, because I see so much of it too. And it does drive me slightly insane, even as a psychiatrist, to see some of this. I mean, I think even earlier today, I saw something on my Instagram scroll of if you see green in this image, it means you have ADHD. You know, there's so much floating around on social media now that obviously is really grounded in misinformation, but also for me as an ADHD psychiatrist really concerns me, because I think it oversimplifies and actually disregards a lot of what ADHD is. And I've had a lot of patients and even friends and people I know with ADHD say when they see that type of thing on social media, it's actually really quite invalidating to feel that their experience and their diagnosis and condition can be boiled down to oh yeah, you look at this color chart and if you can see green rather than blue, then it means you must have it. And I guess probably goes without saying, but I will go out on a limb and say that those type of simplistic ways of viewing a diagnosis are often really grounded in misinformation and aren't correct.
Can we talk about another aspect of ADHD, and that is dysregulation and rejection sensitive dysphoria? Now, a lot of women I know have experienced this not because they have ADHD, but because they get PMT, in that you go through this week every 28 days where you think everybody hates you and there's no real reason for it, but you just have convinced yourself that everyone hates you, no one likes you, you're the worst person in the world. And that is apparently something that is quite common for people who have ADHD, but not just for 1 week every 28 days.
Yeah, exactly. I mean, it might be slightly worse for that 1 week every 28
Gosh,
days,
okay, so that's
but
RIP
absolutely.
that week, yes.
Exactly. Very, very hard. But no, you're exactly right. For those with ADHD and for neurodivergence in general, we know that regulating emotions can be really quite difficult. I often talk to patients about pinball emotions is the fun / not so fun term I've come to, talk to people about, where there's a sense that our emotions can really shift and pinball and change quite quickly, but also quite intensely. And I think hand in hand with that can, come RSD, where, as you say, we're sort of really, really hyper vigilant to any perceived sense of rejection, abandonment, that the other person or people might be displeased or unhappy. And the interesting thing is that we're starting to see there might be a neurological correlate to that in terms of that vigilance to rejection and emotional responses in ADHD. But the fascinating thing is that for those who struggle with rejection sensitivity and ADHD, it's often because there's been a collection of messages and signs across their life from early in childhood that they're not quite behaving as they should, or they're not quite achieving as much as they could. She would have amazing potential if she just learned to not talk so much in class. And so when it comes to rejection sensitivity, it's often this background history of being made to feel and soak in explicit and implicit messages across a lifetime that lead us to be really, really sensitive to gauging how we're doing with other people. And if we sense that there's a sense from them that we are not doing as we should, performing as we should, or that they might be considering rejecting or leaving, that can strike this hugely powerful emotional and even physical type reaction where we feel that intensely. And so we now know that that is really, really common for a lot of people with neurodivergence and ADHD.
Do we know what causes ADHD? I've been reading quite a bit that it's got a genetic, hereditary aspect to it. Is that what we sort of understand as its root cause?
Yeah, absolutely. We know that compared to especially a lot of our psychiatric or neurodevelopmental conditions, ADHD has a significant genetic component. So we are much more likely to have a diagnosis of ADHD or maybe struggle with subdiagnostic traits or elements of ADHD if we have a direct family member who also struggles with ADHD or has the diagnosis. So there is, in that sense, a very genetic or biological, neurochemical, as we've touched on, element to the condition. We're not exactly sure how and why that gets expressed in some people rather than others. There's no clear environmental cause for ADHD or one clear trigger or switch. And so it's probably, as with much of medicine, this really complicated melting pot mix of genetic, biological, environmental, and other factors that leads to ADHD being there. But I think it is important to point out that as a condition and a diagnosis, in terms of our current understanding, we know that ADHD is obviously, as we call, a neurodevelopmental condition. So the premise there is that it's something that is slightly different in terms of how our brain works and functions, that has been there right from day dot and very early on. And there have been consistent symptoms within that have been there from early childhood and then onwards into adulthood.
Well, finally, let's talk about medication. I did see this great video of a doctor who said the side effects of taking ADHD medication might be that you graduate high school or graduate university, or reduce your likelihood of getting arrested or becoming an addict or getting divorced. Like, can we talk about the impacts of ADHD medication?
Absolutely. And I love that spin on it as well. I think there's a lot out there about ADHD medication, but as you say, if the diagnosis is there, if the medication is right for someone and it works, the positive side effects and spin-offs can be, some massive improvements and supports. And so I think when it comes to medication, it's remembering that is kind of the primary thing there. It's a potential kind of way to support and help people manage the symptoms of ADHD. I think it's important to know, and I plug away on this all the time, and my patients will know this, but it's really, really important to not feel like medication is the only option, because it's absolutely not. We know that psychology and coaching for ADHD can make a huge difference. As we've said, things like a balanced diet, regular meals, exercise, sleep, managing other elements of our mental health like mood and anxiety. These things can all help support and prop up our brain to make sure ADHD symptoms are significantly improved.
What's the side effects that we need to be concerned about with any medication? Obviously, they're never 100% safe all the time. What do we need to think about with that? Especially because I guess young kids are getting medicated now too. So what do we need to be mindful of?
Absolutely. I think it's really, really important with any medication, obviously even for physical health, but especially for mental health, there is always a weighing of those risks versus benefits. And that's why it's not just important that medication is only considered for a formal diagnosis of ADHD, but in my clinical opinion, when the symptoms are at a significant enough level where they're functionally impacting us and causing distress, to the point where we're obviously, willing to take the benefits, even if there are slight, ever so tiny risks to these medications. And when it comes to stimulant medications for ADHD, there are some potential significant risks, even though those are very, very low. I don't want to worry people or parents at all. But some things adults notice. And I obviously only treat adults at the moment for ADHD. But with adults, we can notice some initial things because it is a stimulant around our heart rate picking up slightly, maybe some headaches, shakes, even feeling slightly anxious as the medication settles in. But significant symptoms to watch out for can be reduced appetite, reduced food intake, and loss of weight. That's one that means kids need to be regularly monitored by their pediatrician or psychiatrist and GP. Sleep can be something that's impacted sometimes. And the very, very rare but potentially serious side effects would be around the heart and brain. And so depending on the psychiatrist and doctor, getting checks for heart function with an ECG, getting routine blood tests, getting a medical exam, all of these are parts to the medication side of things that mean we try and make sure there are no significant risk factors or contraindications for people. Generally, they're very safe medications, but as we mentioned, it's always a weighing up of risks versus benefits. And, it can be a complicated question. So definitely one of people, whether they're on medication or not for ADHD, if you have concerns, if you have questions, going straight to the horse's mouth and talking to your GP or your psychiatrist about that is really, really key.
A really big thank you to Dr. Kennedy for taking the time to explain a bit more about ADHD to us. Mariam, how did you feel about what he said?
Yeah, like what he was speaking about with females obviously getting diagnosed later in life. And that's generally what we see in general practice is, females in that 45 age range group coming in and getting that diagnosis. And a big part of it is those cultural and gentle pressures to behave a certain way. So it's really sad to think they've been masking and acting for all this way because of all these pressures on how they should behave.
It sounds thoroughly exhausting that they've had to essentially put on a show every day just to get through from waking to sleep. That's incredible. Okay, so I've had someone actually come up to me to ask you this question. Yeah. She went to her GP and she has been diagnosed with ADHD. She has been placed on medication. And then when she went to her GP about it, the GP said, "So how long do you want to be on this medication for?" And she was like, "I don't know. Shouldn't you know the answer to that?" What do you say to that?
So when people first get diagnosed with ADHD, depending on their symptom severity, we always want to start medication so that they can access the non-pharmacological side more effectively, right? Mm-hmm. So you want to kind of help with the symptoms so they get the best out of that non-pharmacological approach. And then how long they need to be on that medication is all going to be based on the doctor and the patient and their preference. So I always say we do a yearly review. We review the patient, their progress. Are they suffering from any side effects with the medications? How they're feeling, where their head is at. And if they want to get off the medication, that's something we can definitely trial, reduce the dose, see how they go. And some people can get off it, and that's fantastic. But some people might need to be on it for a little bit longer. So it all really depends where the patient is at in their life and if they're ready or not to get off the medication and how they're going to go when they are off their medication.
So basically the answer is whenever it's right for you.
Whenever is right for you.
Okay, brilliant. Next, we are heading into the consultation room to find out exactly what is totally fine and normal when you touch your boobs and might find something a little lumpy, and what is a totally not fine and needs a biopsy kind of lump, as we remind you all to do your monthly boob checks.
The doctor will see you now just through here to consult room 1.
It is time to head into the doctor's office for today's quick consult. Dr. Mariam, please, if you would, invite us in.
Thank you for waiting. How can I help you?
Oh, love it. So this is where you can have your health concerns heard. If you have something you want to ask Dr. Mariam or any expert in the health space, make sure you reach out. Our email is well@mamamia.com.au or leave a voice note. You can find a link to that in the show notes. Amali sent in this question, and it is one for all the lumpy boobed gals. Okay, here we go. She wrote this. I really don't know if I'm doing my breast exam self-checks right. I've been checking them for a while now, and they seem to have some structures, more than just fat inside there. They're not lumps as such, but they're not lumps, if you know what I mean. What else other than fat am I feeling when I'm doing my boob checks, and when should I be taking my concerns to the doctor? Now, I hear you, Amali, as a fellow lumpy boobed gal, and I've been trying to tell my colleagues that I wish it wasn't an HR violation and I could allow them to touch my boobs so they could feel what I can feel, because everyone's boobs feel different, right? They have decided not to break that HR violation. Your loss.
Fair. Exactly.
So how do we tell the difference, and what are we actually feeling when we're feeling our boobs?
Yeah. Amali, first of all, great work that you are breast aware. Mm-hmm. So we know breast self-awareness is about becoming familiar, having a relationship with your breasts, getting on top of how they look and feel. So generally I advise all my patients to be breast self-aware, and that's doing a breast examination every month. And I generally recommend that 2 to 3 days after your period. If you don't have a period anymore, setting a start date every month and sticking to that date. Everyone's breasts look and feel different. They may be lumpy, you might have inverted nipples, whatever it might be. Everyone's breasts are normal. So you need to get used to your normal by doing these self-examination tests. So Amali, the things that you might be feeling when you're examining your breasts, they might be the fatty tissue, which you've described. There could be the glandular tissue, and that includes the lobes and the lobules, and that's what produces milk. Then you've got the milk ducts, which are thin tubes that go from the lobules to the nipples. You've got the nipples and the surrounding.
Sorry, can I interrupt? Because lobules is the most glorious word.
Yeah,
I have never heard that before.
Lobules.
Is that what I'm feeling under my nipple there? My lobules?
You've got some lobules.
Oh, I love that.
And then, so you've got these milk ducts, which are thin tubes that carry the milk from the lobules to the nipple and the surrounding areola. And then you've got the supportive connective tissue. You've also got lymph vessels and lymph nodes. And when you're doing an examination, you want to make sure that you're going under the arm, around the breast, all the way below the collarbone. And so for all those lumpy breasts, you need to know what your normal is. So if you're feeling something and you're not quite sure, just go in and see your GP. They'll do a breast examination and they'll decide whether or not you need some imaging. If the imaging is all fine, then we know that's your normal, and then you just continue examinations, and then if anything changes, you see your doctor. So it's just knowing what is right for you and what is your normal. But it's very important to note that self-awareness does not replace the 2-yearly mammograms. So you still need to do those mammograms from the age of 50, or if you want to do them earlier, you can do them from the age of 40 as well.
There's also been a lot of chat around about dense breasts because imaging, it's harder to pick up breast cancer if you have dense breasts. Can you feel if your breast tissue is dense? Like, would it feel different to someone whose isn't?
It may or may not feel that way during examination. We only generally pick that up in imaging. But if you've got any concerns during an examination and you're feeling like, I don't know if this is normal, just see your doctor, get some clarity. Don't leave it.
All right. Thank you, Amali. And remember, if you do want to send through a question to Dr. Mariam, go in our show notes, leave us a voice note. Or if you want to remain anonymous, there's a way to do that too. Thank you so much for joining us on our Well Adventure today. If you have any questions about what we discussed or any health concerns you want us to look into, shoot us an email, well@mamamia.com.au, or leave us a voice note. Next week, we're talking about 2 things that can either be a constant companion or an infrequent visitor, but always messes with our heads. It is something that both Mariam and I have experienced at some stage. We're talking about anxiety and depression. They also sometimes hang out together along with ADHD, as we found out today.
Jeez, could you imagine this bunch of friends?
It's diabolical when they get together.
3 people entered a room. Nobody came out.
Nobody came out.
One forgot that they were there.
I'm so sorry, ADHD sufferers. We know it's not funny, but I've seen TikToks where you're all making fun of it, and it's hilarious.
It's a superpower for many.
It is a superpower for many. If you are interested in anything that you have heard or learnt here today, make sure you sign up to the Well newsletter. You can find a link to that in our show notes. Of course, the advice that you've heard here today, it's general. It may not suit your exact needs. So make sure you reach out to your own doctor or health specialist to get the info that is 100% right for you. And Mariam, we will see you for your appointment next week.
Bacterial peniosis!